A Doc SIBO and Max Studio Productions presentation. How SIBO can lead to anemia and fatigue. To begin, I will provide a brief explanation about the SIBO anemia and fatigue connection. Too much bacteria in the small intestine, known as SIBO, small intestinal bacterial overgrowth, can cause anemia and fatigue through various mechanisms. It disrupts the absorption of vital nutrients like iron and vitamin B12, which are essential for producing red blood cells and energy metabolism. This deficiency can lead to different types of anemia and cause symptoms like weakness, fatigue, and decreased energy levels. SIBO is a severe condition that affects the small intestine and causes inflammation. This can make it difficult for the body to absorb nutrients, disrupt the production of red blood cells, and lead to anemia and fatigue. To address these problems and improve nutrient absorption, it is essential to effectively manage SIBO by using antimicrobial therapy and making nutritional adjustments. To alleviate anemia and fatigue caused by SIBO, it is essential to restore the balance and number of bacteria in the small intestine, as well as optimizing nutrient intake. Effective treatment of SIBO can help the body regain its ability to absorb nutrients like iron and vitamin B12, leading to better red blood cell production, oxygen transport, and increased energy. Collaborating with a healthcare professional knowledgeable in this area of expertise is crucial for properly evaluating, diagnosing, and treating SIBO-related anemia and fatigue. They should be able to provide individualized guidance and support to address the underlying factors of SIBO, enhance nutrient absorption, boost energy levels, and alleviate symptoms. How can SIBO lead to iron deficiency? SIBO and iron deficiency share common symptoms and connections. These include 1. Fatigue. SIBO and iron deficiency can cause fatigue and low energy levels. Iron is crucial for carrying oxygen in the body, and its lack can lead to reduced oxygen supply and fatigue. 2. Digestive issues. SIBO can cause digestive issues such as bloating, gas, abdominal pain, and changes in bowel movements. Iron deficiency can also contribute to digestive issues like constipation or diarrhea. 3. Anemia. Iron deficiency is a common cause of anemia. Anemia occurs when there is a decrease in red blood cells, or a reduced ability to carry oxygen. SIBO may not directly cause anemia, but it can interfere with nutrient absorption, including iron, leading to iron deficiency anemia. How can SIBO lead to B12 deficiency? SIBO can also contribute to vitamin B12 deficiency, leading to additional symptoms and complications. Some connections between SIBO and B12 deficiency include 1. Anemia. SIBO can interfere with the absorption of vitamin B12, resulting in megaloblastic anemia, a type of anemia characterized by low red blood cell production. 2. Nutrient competition. Bacteria in the small intestine can compete with the host for nutrients, including vitamin B12. This competition can further contribute to vitamin B12 deficiency. 3. Malabsorption. SIBO can cause malabsorption of vitamin B12, resulting in lower levels of B12 in the body. Factors such as previous gastric surgery, gastrointestinal diseases, or certain infections can contribute to this malabsorption. People with SIBO and B12 deficiency may display symptoms of anemia, low levels of vitamin B12 in their blood, and indications of malnutrition as detected by lab tests. It's important to note that while these symptoms can occur in both SIBO and B12 deficiency, they are not exclusive to these conditions. How can SIBO lead to B12 and iron deficiencies? Impaired nutrient absorption. SIBO can disrupt the normal function of the small intestine, where nutrient absorption occurs. SIBO can damage the lining of the small intestine, and interfere with the absorption of essential nutrients, including iron, vitamin B12, and folate. Deficiencies in these nutrients can result in different forms of anemia, including iron deficiency anemia and megaloblastic anemia. These types of anemia are characterized by a decrease in the production of red blood cells, leading to an insufficient capacity to carry oxygen effectively. Anemia, in turn, can cause fatigue, weakness, and decreased energy levels. Nutrient competition. SIBO can compete with the body for nutrients such as vitamin B12, iron, folate, fat-soluble vitamins, and carbohydrates. This competition can lead to potential deficiencies and associated health issues. SIBO can cause malabsorption of carbohydrates, especially complex carbohydrates. The excessive bacteria in the small intestine can rapidly ferment these carbohydrates, leading to symptoms such as bloating, gas, and diarrhea. SIBO can consume and utilize iron, reducing the availability of this essential mineral for the cells. This competition can further contribute to iron deficiency anemia and associated fatigue. Intestinal inflammation. SIBO can trigger inflammation in the small intestine, due to bacterial toxins and immune system responses. Chronic inflammation can interfere with the absorption and utilization of nutrients, disrupt red blood cell production, and contribute to anemia and fatigue. SIBO toxins can cause inflammation and immune reactions in a few different ways. When there is an overgrowth of bacteria in the small intestine, these bacteria produce toxins that can be harmful. These toxins can directly interact with the immune system, leading to inflammation. They can also damage the protective lining of the intestines, allowing harmful substances to enter the bloodstream and trigger a widespread immune response. Additionally, some toxins can produce reactive molecules that cause tissue damage, and contribute to ongoing inflammation in the small intestine. Vitamin deficiencies. SIBO can lead to vitamin deficiencies, including iron, B12, and folate, which are crucial for red blood cell production and energy metabolism. Insufficient levels of these vitamins can result in anemia and fatigue. The importance of gastric acid and intrinsic factor production from the parietal cells of the stomach. The cells of the stomach that produce gastric acid and intrinsic factor are called the parietal cells. These specialized cells are found in the lining of the stomach. Adequate production of gastric acid is essential for the digestion of complex proteins in our food, and for the absorption of B12 and iron by the body. Intrinsic factor is essential for absorbing vitamin B12 in the distal portion of the small intestine. Without adequate levels of gastric acid, B12 and iron absorption can be reduced, resulting in a significant risk in anemia and fatigue. Insufficient production of intrinsic factor and gastric acid can hinder the absorption of vitamin B12 and iron, simultaneously leading to iron and vitamin B12 deficiency anemia. It is crucial to address the underlying causes of these nutritional deficiencies and anemias, in order to effectively manage and treat them. Malabsorption of B12 in food is the commonest cause of B12 deficiency in older people, 60 to 70% of cases, while pernicious anemia, low or absence of intrinsic factor, accounts for 15 to 20%. Malabsorption of B12 commonly results from distortion of local anatomy, previous gastric surgery or resection of small intestine, Crohn's disease, celiac disease, Whipple's disease, chronic alcoholism, or even tapeworms infections. Pernicious anemia is another crucial cause of B12 deficiency. It is an autoimmune condition with a lack of intrinsic factor, due to the destruction of the gastric mucosa. Antibodies are commonly detected. These include anti-intrinsic factor and anti-gastric parietal cell antibodies, which are sensitive but not specific to this condition. Let's review. SIBO and iron deficiency. SIBO and iron deficiency can cause fatigue, digestive issues, and anemia, low red blood cell count. SIBO can interfere with iron absorption, leading to iron deficiency anemia. SIBO and B12 deficiency. SIBO can contribute to vitamin B12 deficiency, resulting in anemia and other symptoms. SIBO can hinder B12 absorption and compete with the body for nutrients. SIBO's effect on nutrient absorption. SIBO damages the small intestine, affecting the absorption of essential nutrients like iron, B12, and folate. This can lead to various types of anemia and deficiencies. Importance of gastric acid and intrinsic factor. Gastric acid in the stomach aids in iron absorption, and intrinsic factor aids in B12 absorption. Insufficient production of these substances can cause deficiencies and anemia. It's important to note that SIBO is not the sole cause of anemia, iron deficiency, or vitamin B12 deficiency. Other factors, such as dietary deficiencies and underlying health conditions, may also play a role. Proper management of SIBO, including antimicrobial therapy and addressing nutrient deficiencies, is essential for treating anemia and fatigue associated with these conditions. Suppose you are experiencing issues related to SIBO, such as anemia, iron deficiency, or B12 deficiency. In that case, it is recommended that you seek the advice of a healthcare practitioner who specializes in SIBO. They can provide the best testing and treatment options for your specific condition. Thanks for watching.